Patients are prescribed certain medications in certain intervals and certain doses because that's what's safe. And when that doesn't happen and we become aware of that, that is something that could cause immediate harm to a patient.
Failing to administer medication as ordered by a physician, failing to meet the adequate number of licensed registered nurses and other members of the nursing staff. These are just two items the Connecticut Department of Public Health identified at St. Francis Hospital, and the reason the hospital was placed under a consent order back in 2024. Thank you so much for joining us on Fox 61 News. After the game, I'm Annette Montgomery. Now, that consent order was recently modified after additional violations were discovered. And new tonight, I spoke with the commissioner of the State Department of Public Health about why that order was modified and what the hospital is now saying in response.
I think you're going the other way. Going the other way? No, not.
We had identified several violations that had occurred, and in September of 2024, so this was going back a year ago, we had entered into a consent order with St. Francis Hospital.
This consent order, dated September 11th, 2024, lays out the agreement between St. Francis Hospital and the Department of Public Health after a series of violations were identified by health officials.
We had identified errors in medication administration, sanitation, safety of patients.
According to the Department of Public Health, for the emergency department to be optimally staffed, they are required to have 17 registered and licensed practical nurses between the hours of 7 a.m. and 9 a.m., 18 between 9 a.m. and 11 a.m., 22 between 11 a.m. and 9 p.m., 17 between 11 a.m. and 3 a.m., and 15 from 3 a.m. to 7 a.m. Health officials made unannounced visits to the hospital between November 2023 and March of 2024. The Department of Public Health says they identified 7 registered and licensed practical nurses from 7 a.m. to 11 a.m., 8 from 11 a.m. to 11 p.m., and 7 from 11 p.m. to 7 a.m. The document goes on to say a review found nursing staff fell below the required staffing grid 83% of the days reviewed.
What I want to make clear is that part of our function as the Department of Public Health in Connecticut is to ensure safety in facilities. And so what has come to light in this particular instance is when something is egregious and we are doing the things so that people can feel confident going to a given healthcare institution.
Trinity Health of New England oversees St. Francis Hospital. In a statement to Fox 61, Julie Williams, the regional director of marketing and communications, says in part, "At St. Francis, patient safety is more than a priority. It's a core value that guides everything we do. At the heart of our safety culture is continuous education, rigorous training, and the recognition of our colleagues who exemplify our safety values in action. This safety culture is built upon proactive colleague engagement, open communication, and leadership rounding, ensuring that the voice of both patients and colleagues remain at the forefront." The original consent order from September of 2024 was dated for 2 years, which means the Department of Public Health would be monitoring them over that period of time. But additional incidents observed so far has led to the Department of Public Health identifying an expert consultant would need to be physically on site for 40 hours a week for an additional 6 months.
The original consent order that was issued back in 2024 allowed us the ability to be there for 2 years and to be monitoring them over this period of time. It's this additional 6 months of this expert consultant, which will now be there into the coming new year in 2026, which was necessitated by additional incidents that we had identified during this time period that have been under a consent order.
And when I raised the question to Dr. Jatani regarding how common consent orders are, Jatani said she would not call it a common occurrence, but when there is something significant that has been identified and a repeated pattern of behavior, that's when one is put in place. Now, that statement from Trinity Health also says their commitment to transparency remains steadfast. We have their full statement right now on fox61.com.